phobias are a type of anxiety. In fact, when I was reading about anxiety, where there are a number of types of anxiety, I came across that phobia is also categorized under anxiety, which I never knew earlier because मुझे phobias different लगते थे, anxieties different लगते थे. But phobias are a part of anxiety. Now, few may ask that what is the difference between a fear and an anxiety. So I'll try to put it as simple as possible. Fear is obviously एक डर जो हर एक इंसान में नॉर्मली होता है. फॉर एग्जाम्पल किसी ने स्नेक देख लिया तो वी आर फियरफुल, राइट, एंड एवरीबडी इज, और टाइगर और समथिंग लाइक दैट. बट फोबियाज आर वेरी स्पेसिफिक. फॉर एग्जाम्पल कि हो सकता है किसी इंसान को फोबिया एक ऐसी चीज़ से हो जिससे दूसरे इंसान को ना हो. फॉर एग्जाम्पल स्पाइडर्स, द फोबिया फॉर स्पाइडर इज is the commonest phobias. So it's not that everybody is having the same intensity of fear with that spider, but people who have phobias against spider will have other level of fear. So the fear and phobia are different. Fear is rational, right? And one person and every person may feel fearful related to an animal, insect, or places. But phobias are very specific. In fact, phobias are known as a deliberate fear of an object, place, situation, feeling, or animal. And this is more irrational. One may feel it, the other may not feel it. So there are extreme cases of fear which people may have regarding any and every of these situations. So when you say phobia, for example, if I have a phobia for insects, for example, I may not have during normal circumstances, unless and until the insect comes in front of me, or in fact a lot of times even the thought of that insect or a place for which I'm having a phobia may raise my heartbeat, or may create that panic situation in me. So phobias are that serious. In fact, phobias are that much intense for a person that even the thought about that thing may literally bring shivers to that person. When the person experiences the phobia anxiety, the person may feel very uneasy. There are a lot of physical and psychological symptoms which the person may come across. In fact, the person may feel unsteady or dizziness or lightheaded. In fact, the person may feel nausea or sweating, or as we believe that anxiety brings the wetting of palms, for that matter, or something like headache, for that matter. Also, it may happen that trembling or shaking may happen in the legs or in the body. Also, the person may feel breathlessness and dizziness, giddiness, and all. So there are a lot of physical and psychological symptoms if the person faces phobia. In fact, phobias have categories. Normally there are two types of phobias which exist. The very first is simple phobia and the second is complex phobia. And when you say simple phobia, this is the common type of phobia which we normally talk about. As I said, it may relate to a place, a situation, animal, insect, or anything like this. And the simple phobia normally starts in childhood, and as we grow and mature, probably the phobia reduces. And on the contrary, the second type of phobia is the complex phobia, and this is a phobia which may develop because of certain situations or incident which the person has come across. And this phobia is something which develops in adulthood, and this is something which is really difficult to overcome or treated. So simple phobias are result of childhood memories which may be erased later on, but complex phobias develop in adulthood, which is relatively difficult to take care of. But having said that, it's difficult but not impossible. So there are treatments and there are methods in which the phobias can be treated. Some of the examples of simple phobia can be related to, animal phobias. You would have seen there are few people who are afraid, they have got intense fear for dogs especially, or for that matter cat. So animal phobia is one of the simple phobias. Then environmental phobia, it relates to, height, or probably, something like deep waters. And one more simple phobia can be situational phobias, or they can be bodily phobias, or in fact sexual phobias also exist. So these are few of the examples of simple phobias. And when we talk about complex phobias, there are just two categories of complex phobias. The very first is agoraphobia, and the second is social phobia. So agoraphobia is a phobia which people tend to have, who are afraid of open spaces. In fact, they have a fear of getting lost. So normally these people avoid being alone or avoid being in crowded places also. So agoraphobia is one of the types of complex phobia. And the second is your social phobia, which means that you have a problem with interacting with people and being on a social platform for that matter. And this is a phobia which we have already discussed. Causes of phobias are quite similar to the other anxieties which we discussed earlier. What can cause phobias? The very first is the person would have experienced something of that sort, and that's the reason these experiences have accumulated and now have resulted in a phobia. Second can be genetic causes. In fact, there are few people who are born with that anxiousness level, so they are more anxious towards things or specific events or something like that. So genetics is one of the causes. And the third cause is related to modeling. In fact, they would have had maybe their parents or their sibling who have this phobia, right? And by modeling them, looking at them, observing them, they have also developed this anxiety issue or this phobia issue, because they have seen it and imbibed in their personality. So basically there are three reasons for phobias, as I said. The first is some specific incident. The second is the genetic factor, and the third is the learned behavior. So these are the causes of having phobias in a person. See, treatment of phobias also exists. In fact, treating simple phobias is easier as compared to complex phobias. As we discussed, that simple phobias are those phobias, which a person may have because of, animal or places or something like this. So, in the treatment, what is done is the person is exposed to the phobia which the person has. So, probably if a person is having a phobia for animals or dog, the person is more exposed to that incident or that animal. So slowly and steadily what happens that this gradual exposure leads to desensitization or self exposure therapy. So the more exposed you are, slowly and steadily your fear goes off. So this is one of the common ways of treating simple phobias. Also, the other things like counseling, psychotherapy, and the most common is your CBT, that is cognitive behavioral therapy, that can work. But if as all other anxieties, if these don't work, we tend to depend on medication for that matter. So there are antidepressants, tranquilizers, and beta blockers which can be given to the patient, obviously under the consultation of doctor. In fact, I love to bring this interesting piece of information that the top four phobias are, the very first is related to spiders, that is arachnophobia. And the second is related to confined places or closed spaces, which is known as claustrophobia. The third relates to agoraphobia, which relates to open spaces and public spaces. And the last, among top four is social phobia, which relates to fear of social situations. So these are the top four phobias. In fact, I found a list of 20 unique phobias. In case you are interested, please do let me know. I'll share it with you. So, this was a little brief about phobias, which is again one of the types of anxiety disorders people may have. And as I said, like any other anxiety, this can also be treated, right? Because no fear is permanent, but you just need to face your fears. Slowly and steadily the fears goes off. So thank you so much for watching, and God bless.